But maybe if you sing the song rather than two front teeth, maybe for you it's like, all I want for Christmas is some brand new feet, some brand new feet, some brand new feet. That sounds catchy, right, Dr. Nguyen?
Yeah.
You going to sing that in the office now?
Well, I don't know about that.
Okay.
I'm not that talented.
Oh, please. You think that was talent, huh? Dr. Helene Nguyen is here, and she, of course, from Feet and Beyond of New Jersey. Good morning to you, and you're my latest Facebook friend, so thank you for that.
Well,
Very cool.
Yeah,
thank you so much.
It's definitely great to get connect with you.
Yeah,
on
thank you
social
for
media.
that. Appreciate that. And you're watching my video teas every morning at 5 in the morning,
Oh,
so
yeah,
thank you for that as
is,
well.
My morning routine as well.
I greatly appreciate that. But foot pain, Dr. Nguyen, there's no such thing as a holiday when it comes to foot pain. You can't just go to bed and get up the next morning and foot pain goes away. It doesn't work that way, right?
No, never.
You have to take action, do something, right?
Unless you, yes, and absolutely, unless you are aware of it and take action, like you say, and take care of it and try to get to the bottom of it. That's a key.
And some people said, you know what, I wish I just had some better feet or my foot pain would went away for the holidays. But there's still time to do something about it. It's just take action and take hold of things and make the decision to get it done.
Of course, yeah. That's why they have a bunion blue. That is the theme that we want to talk about today. Bunion blue is
bunion blues.
Bunion blue. This doesn't mean that it's only for the holiday time, but we want to bring that up as a holiday. Is that you want to be a little reflections upon take care of yourself, take care of your family, spend time with family. So bunion is one of those conditions. It can be very progressively worsening. Some patients have bad bunion, and if they know they have bunion, they know they have bunion. It's so popular, but not that many people talk about that because sometimes it didn't really bother them so much until it's got really advanced, and it's debilitate patients, debilitate people from walking, doing their activities, and around the holiday time, that's coming out more often because we go shopping, we spend time more with families and do things, and then we be able to just feel that more. Yep.
It's like anything else. The earlier you address it, the easier it is to recover from. And I've seen the before and after pictures on your social media. It's remarkable work. It's like I do a double take, and is that really the same foot on the same person? And it's like night and day. It really is.
Yeah, absolutely. With the techniques that we use in the office, we'd be able to get the patient in, do a procedure, and the patient walk out the same day with no hardware. And it's a very safe procedure and low risk for any of patient who concerned about foot problem. They can always consider that because that is a message we want to send out to the community. That is a better way to correct bunion problems more than what they used to hear about. Yeah,
and it's bunions, heel spurs, flat feet, hammer toes, even nerve damage, neuroma. What's neuroma?
Neuroma is when there's on the branch of the nerve to the toes that is actually become inflamed and is swelled up. It's kind of like a tumor. We call it a tumor. It's just basically it's a collection of the inflammation of the nerve that's irritated. So when a patient starts walking, every step that they make, they irritate that branch of nerve, and it's become shooting pain. Whoever have neuroma, they would know exactly that's what Dr. talk about. They feel like a pebbles, like they walk in the pebble all the time on the bottom of the foot, and it can be very debilitating.
Certainly doesn't sound pleasant, that's for sure.
Not at all.
No. And people are worried about scars or stitches, Dr. Nguyen, when they have some work done and they come to see you. What can you say about scars and stitches?
Yeah, with the minimal invasive approach, that the incision, the skin incision, is actually as small as 2 millimeter, literally just like a dot on the skin. And most of the time, I don't really need to use any suture at all. So the scarring is almost like non-existent, like after 2 weeks of procedure. And that is one of the aesthetic part of it, because when people who have foot problem, they want to wear sandal after the procedure. You don't want to show it off or the scarring. And, some people, they don't really care about it as long as there's no pain. It's a functional issues. But other part of it is aesthetic, especially for the women. You know, when we need to wear nice shoes and we don't want to show off our scar either.
Exactly. Dr. Helene Nguyen is here from Feet and Beyond of New Jersey. The office, 188 Mountain Avenue, Hackettstown, 908-576-0880. Website, feet_beyond.com. We're talking about some things when the holiday season here. Some insurances that you take part in, Dr. Nguyen, and also do some out-of-network benefits. Can you talk about that?
Yeah, so we there are some insurance that we participate with, and most of the time now that everybody have the out-network benefit, and that will be able to cover for the part that when we do surgery and we not participate with, and and we also on the same token that we do have a very affordable cash price package for the whole entire process of the surgical option. And that is something that will cover from A to Z. They don't have to worry about any extra expense for the post-op care, which is after surgery care. And that is something that we would like to advocate for, for the people who doesn't have insurance. They're afraid that when they go for foot surgery, that's going to be costing them so much. And our pricing is very transparent. We tell the patient right off the back that, how much they're going to expect to pay and be responsible for.
And it's almost like, Dr. Nguyen, we're trying to get people's mindsets to be different, because sometimes people think, well, I guess let me look at a bunch of different things, and if I have to get surgery, I'll do that as my last resort. But when you just take that thinking and reverse it and look at the surgery thing early on, it makes such a big difference for people.
Yeah, so most of the time that I tell patients, I can help them with their foot pain, their problems, but I cannot give them back the time that they spend on foot pain. So that is something that we can never get back. It's a time that we lost due to foot problems. So we hear, and we try to advocate, like you say, that we try to take on upfront the hassle of dealing with the foot pain is delay your activity level, is waste your time. It costs you time and money actually, because if your foot is in pain, you cannot go to work. So is that really, it's a little bit counterproductive, right? If you really think about it.
Especially if it's something that can be addressed and fixed, right? I do remember Feet and Beyond, one-stop shop for transforming your feet and also at the same time transforming your life. And it really is a game changer, no doubt about it. We're getting closer to the holidays. There's still time if someone wants to get an appointment with you before the holidays, they can do so, right?
Yes, we do have 1 week off between Christmas and New Year, just to give our staff a 1 week holidays and hang out with their families. So we take appointment until Christmas Eve. We still have a appointment open to have patient coming in to get evaluated by me. But any plan for after the holiday treatment care, we can always make that arrangement.
Great stuff. And again, to make an appointment, 908-576-0880. And remember, they can't give you back the time that you've lost due to foot pain, but they can do something about it right now. That's what it's about, embracing the moment, right, Dr. Nguyen?
Exactly. Just do it.
Just do it. Well said. All right. Thanks for stopping by. Great as always. Best to you and everybody for the holidays that are coming up. And we'll talk again after the first of the year, right?
Absolutely. Have a good holiday.
You too. See you on Facebook tomorrow morning about 5.
Yes.
Right? Okay. All right. Dr. Nguyen, always a pleasure. Thank you.
All right. Thank you.